Hello and welcome to KOCT's North County Roundtable. We're all hoping that you are doing okay out there. And I'm Alison St. John. My colleague Kent Davey and I are here. And we thought that this time we really should be looking at how North County is preparing for the coming peak that we know is coming of this pandemic. Kent, do you want to say a couple of words about why you think it's so important that we focus on North County?
Well, because there is lots of reporting about the world and the nation and California and even San Diego as a whole. Pretty easy to find out what the caseload is like for the county, and you can drill down by zip code even to the cities, but it doesn't really give you a sense of where things are at up here in North County. We're spread out more, it's more suburban. Presumably that gives us a slight advantage, I would think. So the question, I guess, if the numbers, the projections are that hospital resources will peak around the 14th or so of this month for the state, how are we going to do? We meaning North County, Tri-City and Palomar and Scripps.
Right. Well, we're recording this on Monday the 6th, so any specific numbers that we put out today may or may not still be relevant while you're watching this, but just bear that in mind. So our first segment here, we're going to be speaking with the Chief Medical Officer of Tri-City Healthcare, and that is Dr. Jean Ma. And Dr. Ma, we'd like to welcome you and thank you so much for making yourself available today.
Thank you for having me.
Can you give us an idea of, for your hospital, what the impact of this disease has been so far?
Well, fortunately, so far it's been fairly light. What we're seeing is that the models do project California is projected to start to see its rise here pretty significantly this week. The expectation is maybe we're not quite New York. We are a little bit more spread out, as you alluded to. And California, particularly San Diego, we may be a little bit shifted a little bit towards the right. So as of yet, while we know that there's some activity north of us and south of us, in North County, we've had a little bit of a pocket, but I knock on wood, as we certainly are aware that when this actually does tend to hit its surge, what we've seen in other areas is the surge tends to happen virtually overnight.
Mm-hmm. Right now, looking at county numbers, the total caseload looks like it's doubling about every 6 days. That doesn't seem to have slowed down yet. Is there any evidence of whether the social distancing has flattened the curve, as the experts like to talk about?
Well, from looking at the models, I've seen various models. Looking at the models we've seen, there is some evidence that it may be having an impact. But I think a lot of it is still unknown and yet to be told.
So, Dr. Ma, what is Tri-City specifically doing to prepare at this point? What have you done that's different from your normal routine?
Everything. This is as I think everybody can attest to, we have so far diverged from our normal. But I think there are so many lessons that can be learned from other states and other regions and other countries that we've tried to be proactive and learn. And so the approach has been both local and regional at a county level, state, and of course, federal preparations. A lot of it is reporting. A lot of it is really kind of getting a good sense. We report at every level, to the county, report to the state, and report daily also to the federal government, so that we have a better sense as to what resources are being utilized and where those resources are being utilized. But I think a lot of the lessons that we've learned from other countries and in New York and the state of Washington have kind of given us an advanced preview into the things that we really need to be doing to prepare North County in case we hit that surge. Yeah, we certainly hope that doesn't happen. We certainly hope that everything we've done was soon enough and can flatten this curve out, but we certainly can't rely on hope. And so what we've done is locally here at Tri-City created a surge plan that essentially allows us to increase our capacity almost overnight. And also in those areas, we focus largely on the lessons we've learned and where those needs are going to be. Of course, that means ICU care, that means ventilators. We've tripled our ability to increase our ventilators in anticipation of the fact that patients don't seem to be in the middle. They tend to be in that 81%. Those numbers seem to be fairly accurate from what we're seeing. They either tend to be, the large proportion do very well. They don't feel well, but they are actually going to be okay. But the ones that come to the hospital often are quite ill. And so the preparation is largely around capacity from the perspective of having the physical capacity of beds.
What is your capacity, Dr. Ma?
Well, we start at around 222. We have multiple surge capacities, and our surge capacity gets us up to 311. And that's the plan that we've created. And then we've also created plans to be able to try to expand our staffing. We've reached out to our community for clinicians, and within one day, 24 to 48 hours, we had, so almost 2 days, we had 2 pages of staff that live in the area, or physicians that may have different specialty care that traditionally wouldn't work in areas that we're anticipating the surge. And that includes intensive care unit and ER, that have said, look, I may not be able to manage all of the ER cases, but as a cardiologist, I'll come take care of all the cardiology complaints so that the ER physicians can manage all the other patients that are coming in with COVID-like illnesses. So that manages our staffing also. And then it's the stuff that the county has really pushed, is that you have to manage all 3 aspects of it. And the stuff means the ventilators, the PPE, or the personal protective equipment that you hear so much about. And that's actually real, is that the supply chain has been cut off. And so it's very, very challenging to acquire a lot of the things that we need to protect our staff. But here at Tri-City, I think we, knock on wood again, we really tried to be proactive. And we've been able to secure enough PPE such that our staff, I think, do feel comfortable enough knowing that it's there for them. We just have to be safe, and we have to be cautious, and we have to be judicious in our use, because we don't know when this will end. And that's the problem, is we can't model out exactly when things get back to more normal times. And so we really have to be judicious in what we utilize. The next thing is the county has been really fantastic about putting together a collaborative. I speak weekly with all the, daily by email with all the other CMOs in the county. And also the CEOs are communicating, the chief nursing officers are communicating. They all have their own forums. And we're communicating regularly to create a more global regional plan, so that there's this shared, we understand what our resources are, and we're preparing each other, and really taking best practices and implementing them across the board. And also resources. Testing has been really, we've had some fantastic partnerships with UCSD, and Rady's Children's has stepped up and has been helping us with testing too. So it's been a really great county-wide, county-driven collaboration.
Could you walk us through, Doctor, if a patient presents at your emergency room with virus-like symptoms, can you walk us through what's likely to happen to that person?
Yeah, no, that's a really good question. So we actually have, much like every other organization has set up, an external tent in which we manage our lower acuity patients with potential COVID. The goal is at the very front. So when you walk up, you're going to see lots of signage. And at the very front, we have somebody that prevents anybody from entering the building without being screened. You're immediately screened for symptoms. And if you are screened as potentially a patient that may have symptoms compatible with COVID-19, you're directed to a different area so that we're not mixing populations of patients, so that we can manage patients with potential COVID differently. Once we do that, we do have a triage process in which we identify patients that are at lower risk or lower acuity, and those patients are managed in our COVID tent, so that they can be quickly seen, evaluated, decide on whether or not they need to be tested, and then given the appropriate management and instructions. For those that have a higher acuity or a little bit more sick, we have a separate COVID unit in our emergency department that's a closed unit with a separate circulation system that allows us to manage these patients separately from everybody else. And then, of course, everybody else with non-COVID complaints is managed in the other part of the emergency room.
Dr. Ma, I wanted to ask you whether you think that North County is as well provided with hospital beds for that 20% that might need it as, for example, the city of San Diego, or do we actually have fewer hospital beds up in North County than some other parts of the county?
Yeah, there's no doubt. We have less beds in North County. But I would say, I think relative to the density of the population, I think North County is pretty well poised to be able to manage this. Again, not knowing exactly what this is going to look like, a massive surge could certainly overwhelm any system, as you can see, even in cities like New York that have so much capability and world-class health systems there. They're obviously overwhelmed. But, I think that, again, the pooling of resources, the county coming together, learning from what other states have been challenged with and giving us that lead time to try to prepare as much as possible. I think people in North County should be reassured that we do have the capability to really bump up our ability to manage really sick patients. But that said, we're entering into really uncharted territory. So depending on what that surge can be, there's certainly no promises. But again, while we do have less beds overall, compared to the overall density of the population, North County appears to be fairly well poised to manage this.
So if somebody finds that Tri-City, which is their closest hospital, is full, is there an agreement that they would go over to Escondido, to Palomar? And I understand Palomar just got an extra 250 beds with federal help. So do they have more beds? I mean, is that likely to be where people would go if you do not have enough beds for North County patients?
Right. So that Palomar has, from what I understand, I don't have all the details of it, has created a collaboration, again, with the county. But that's a federal medical station that will be for a resource. The 250 beds are for the entire county.
Oh, okay.
And so that will be, from what I understand, operated largely by the county. Now, whether or not the details aren't out yet, I'm not aware of the details, but I know it's considered one of the federal medical stations. And so it will be a resource for the entire county. And how fortunate that, we here in North County have that ability, or they have that ability to really have that space to be able to expand into. And so, I think it's a great resource. And again, another example of the hospitals coming together and Palomar really providing that resource that they have. That's really wonderful for the residents of this community.
Do all of the hospitals up here appear to have sufficient PPE right now?
Yeah, I think the answer is generally no. I think the answer is generally no, only because while everybody is getting by, nobody feels comfortable, and nobody should feel comfortable, because when the supply chain isn't there, it's not as if you can just get on and order it again. I think, and everything has been limited down to the wipes that we use to disinfect our counters and our keyboards and equipment. So everything is limited. And so while I think what I hear is everybody is getting by, nobody's quite comfortable because we don't know when this ends.
Right. To the best of your knowledge, have any of the medical personnel here in North County gotten infected?
So I can only speak to our hospital. I'm not aware of any, but I know that what I'm seeing in our testing is that the prevalence is rising. And as the prevalence begins to rise, I wouldn't be surprised that there are certainly personnel who are getting infected, especially given what we do.
Sure. No, you guys are frontline heroes as far as I'm concerned. But
what kind of training are you giving your staff to prepare for this?
A lot of it is, this isn't, in many ways it's different, but in many ways it's not. And I think we have to go back to the basics at a time like this, that we've done this. This is how we manage infectious diseases, respiratory infectious diseases, respiratory transmitted diseases all the time. Ones that are actually much more capable of traveling significantly further distances and infecting us. But I think the important thing is for us, and what we have been doing, is really educating our staff about this disease, and reinforcing the things that we know have been proven with respect to infection control. And so that's reinforcing what we do when we do respiratory droplet precautions and contact precautions, and when it becomes aerosolized, and what we have to do to be able to prevent the transmission of this disease. So much like the things that we are reinforcing out in the community, hand hygiene is critical, keeping social distance is critical, and for us, it's also understanding when we need to appropriately place patients in the appropriate precautions. And so I think that it's donning and doffing, what was basically referred to as donning and doffing, which is how you put on and how you take off your PPE and how you manage your PPE is really critical too. And it sounds so simple, but you try taking something off without touching a surface that could be theoretically contaminated. Making sure that we do those appropriately is critical. And also, we put masks on nowadays with the belief that will help prevent, if I put a mask on, it will help prevent me from infecting you, because so many of us may be asymptomatic or pre-symptomatic, meaning I don't show any symptoms, but I could be shedding the virus. And as the prevalence of the disease rises in our community, the likelihood of that starts to rise. But just imagine you're wearing a mask all day and you're concentrating that virus in your mask. And when people touch their mask and they touch other surfaces, if you touch the outside surface of your mask and you're theoretically getting the virus on your mask, you're potentially contaminating another surface. So again, it's these simple, basic principles of infection control that we really have to reinforce, not only in our hospitals, but out in the community also, that will help prevent the rest of us from getting sick.
With this disease running through the community generally, has this affected like hospital admissions for other non-COVID-19 related medical people staying away, in other words?
Yeah, no, you're absolutely right. That has happened. And we see this across the board. All the organizations are telling me the same throughout the county. For us at Tri-City, we're seeing historically low volumes. I've been here 20 years. I've never seen ER volumes the way they are today. They're very low. So people are heeding the advice of leadership in the county, public health advice, to really only come to the emergency room when you really have an emergency. People are concerned, and appropriately so, but I think that really should be in all aspects of what we do, whether you're going to the hospital or you're going to the local grocery store. That's absolutely pertinent to those, to every part of our daily life. And so, yes, it has impacted our volumes, and we are seeing a lot less of almost everything else.
But Dr. Ma, does that worry you, that there may be people who are having valid emergencies and who are not coming because they're afraid to the hospital?
I actually do have some concerns, and it's anecdotal, but I have seen, looking at some of our cases, patients seem to be a little bit more sick. So I think they're waiting a little bit longer.
Mm. Are there any cases that you've seen so far that give you an indication of what part of the population is being affected? Are there any hotspots or any age groups or any trends that you're seeing so far?
Well, I think that I can't speak particularly eloquently on this, because personally, again, we in North County have been a little bit sheltered right now. What we're seeing, Yeah, we don't have the prevalence just yet, but again, I certainly don't have any false notions that that's going to stay that way for us. But what we're seeing is the distribution seems to be pretty consistent with all the information that we had beforehand, which is, the majority of the people getting it probably are in the younger ages, but they tend not to get sick. And so people are symptomatic without coming to the hospital. Again, anecdotal from what I hear. And yet the ones that do come do often tend to be sicker. They do tend to be those with significant comorbidities, those with chronic lung disease, heart disease, even poorly controlled diabetes, and those 65 and older certainly have a higher risk. And so it is important that we identify those cohorts or subpopulations that need to be particularly cautious, and everybody else in the community should be particularly careful not to be a vector of this disease for those that are at risk and those that are immunocompromised for one reason or another.
How big a slice of the population does it take for herd immunity to set in so that there's some sense of stopping this thing eventually, if there's no vaccine available?
Well, that's a good question. What you're starting to see is serology testing coming out, and serology testing will help us identify who will actually develop that herd immunity. Now, we don't know with absolute certainty just yet if you will actually have immunity, but what we do know from what we're learning is that this virus appears to be mutating very slowly. And in those cases, we do suspect we will have some degree of immunity once you do catch the disease. The serology tests are different from the current tests that are out. The current tests that are out are what we call PCR, or polymerase chain reaction tests, that identify live virus in your nose where it can be identified and found. That tells us if you're actively infected. But these new serology tests come out and they will tell us who has been infected. And what that will help us do is identify exactly at what you're getting at, is who actually has that immunity, and when will we have enough of a population that will provide that herd immunity such that we may actually begin to be able to know who can start to go back into the community again and not be at risk of getting infected and subsequently becoming the carriers.
Is it true to say that once you've had it, you cannot get it again if you've recovered?
Yeah, that's exactly, I think, what we don't know. We don't know that, but again, because of the fact that it appears to be mutating slowly, I think people suspect that, we are suspecting that it's likely that you will develop some degree of immunity that may carry a year, 2 years, 3 years. But that is the hope. But again, too early to really know just yet.
Is Tri-City participating in any of the clinical studies or trials of some of the drugs, et cetera, that people are trying to understand?
That's also a very, very good question. Again, everything that's out there is at this point lacking strong evidence. Our gold standard is to only rely in healthcare on randomized, placebo-controlled, double-blind clinical trials. We don't have those, and we're a ways out from having those. But what we do see is there are things that seem to be potentially of benefit. Everybody's heard about the hydroxychloroquine and zithromycin. Again, the data is lacking, but most people do feel that the downside is fairly low. And so in the appropriate clinical setting, you are seeing a lot of clinicians utilize things like that. Now, as far as those medications that are being tested, some of them, the antivirals, are only available in other countries. What is available here is a product called remdesivir that is manufactured actually by a company here in Oceanside. I think they're based in Northern California. I'm not entirely sure. It's called Gilead. And remdesivir is currently now entering into clinical trials. Tri-City is not one of the clinical trial sites. I think there's one in LA that is a clinical trial site. or that may be an expanded access site. They have various levels. We certainly could petition for on a case-by-case basis, but what we are entering into is another option that we are very interested in looking at. And there's some data from prior coronavirus SARS studies that suggest there is benefit. And there are now a few studies, again, very small numerators of patients that do show critically ill patients improving with what's called convalescent plasmapheresis, in which you take the blood of somebody who has been infected and you pull out these antibodies, these little protective proteins that fight against the virus and neutralize the virus that people that have immunity have. You separate out their serum, you pull out these immunoglobulins, and then you would put that into a patient who is critically ill. And some studies suggest that there is significant benefit to that. Again, too early to know for sure, but we are actually in the process of applying to become one of those sites.
Excellent. Very good.
I know that Tri-City has had some budget issues in the past, and I'm wondering, are you available to take care of people who have no insurance, for example? Could this put an undue stress on Tri-City that could have a long-term impact on its ability to provide health services in North County?
Yeah, I think that this is going to be a significant problem across the board, and you're going to start to see a lot of institutions in distress. I think that Tri-City actually has been fairly stable for some time now.
True.
But this is what's happening, and the reality of healthcare today is that healthcare is essentially a break-even business, and there isn't a lot of margin. So hospitals are not banks. They're not well capitalized to be able to withstand multiple months without any income. And when you turn off the surgeries, which is what's happened, when you turn off all the elective procedures, that's where hospitals have some margin. But now, right now, all of that is gone. The income is really essentially turned off, and it's all expense. And in a business in which there's very little ability to sustain that for a long period of time, I think there are going to be a lot of challenges, and I think you're going to start to see that throughout the country. You're going to see a lot of challenges there.
But would you turn somebody away who did not have insurance?
Oh, we've never done that.
Okay.
And we're not about to start now.
Okay. I just wondered, because I know that one is supposed to call before coming to the emergency room.
Yeah.
What point is it bad enough to call? And if you don't call, what is the best thing to do to take care of your loved one at home?
Calling is great because it alerts us to somebody and their symptoms and what we need to do before they even get out of their car, which is helpful to us. Preparation is always helpful. We're a little bit more set up in the emergency room and at a hospital to be able to manage that, but especially going to the doctor, I think that's very important to call your doctor ahead so that they can be prepared, because obviously it's much more challenging in that setting to try to separate people very easily. By the time you enter the waiting room, it can be nobody wants to have that mixing. As far as the things that people should probably be aware of at home, I think that people are telling everybody, hey, if your symptoms are mild, go ahead and hunker down, stay home. What we're seeing from this virus is mild can be asymptomatic, but it can also be not so mild. Most people will tell you the worst flu that they've ever had, severe myalgias and rigors or body aches. And rigors is where you have that shaking chills. And that with the body aches, what we're seeing is people are pretty uncomfortable with this. Normally you would reach for ibuprofen for that, but there is some, again, very limited data, but it does suggest that maybe ibuprofen isn't the best medication for this virus. And so we are recommending that before you reach for ibuprofen, you really should reach for Tylenol for fever control in this setting. The main things people should be watching for is difficulty breathing. It really attacks the lungs, and lower respiratory complications is where we really get into trouble. So outside of the flu-like symptoms, if you have difficulty breathing, high fevers with a severe cough, and things are progressively worsening, you really should reach out to your physician. And of course, if you're having difficulty breathing, severe chest pains, we're always going to be here for those that really need emergency care.
When you say high fever, how high? What's high fever?
So we generally in the emergency room generally think above 102.5. Fever is considered as low as 99.6 to 100.0. We're using a lower threshold to try to screen patients. But once we get above 102.5, and if you're not able to control that with Tylenol, then we really get concerned. So if after you've taken your Tylenol, an hour later, your fever's not coming down, it's persistently 102.5, 103, we certainly think that you should at least reach out to your physician, or again, in those instances, we certainly have concerns that you may be getting sick enough that we really should see you in the hospital.
Okay. Doctor, what else can we out here in public land do to help you? Wash our hands.
Yeah, I think those are great messages. Wash your hands, do the things that that public health is really imploring people to do, which is really stay away, help us flatten that curve. But I think the other thing is, I've never seen this level of support from the community. This community's been so fantastic from the very beginning. They've always been a great, closely knit community here in North County. The rally of support that we're seeing, the signs that people are putting out, and just the words of encouragement mean a lot to our staff. But the donations, we're seeing a lot of people really doing what they can, and it means a lot. People are making shields, people are making masks, people are making donations to our foundation, and that every little bit helps. They really do. Every little bit helps. And so if people have an opportunity and the inclination and the means to do so, if you can go to tricitymed.org, we'd love to have your support. And there's a link there to be able to, sew masks, donate, whatever it may be.
Oh, very good. Thank you very much for your time today. Really, really appreciate this.
Well, thanks for having me.
Thank you, Dr. Ma, and good luck.
Thank you.
Well, Allison, I think that in another week, we should find out a lot about how bad this pandemic is going to be for us. The experts are predicting California's hospital resources start to peak around the 14th or 15th of this month, which would obviously be another week from the recording of this.
Yes.
So far, what I've heard today from Dr. Ma is pretty encouraging, actually, to me.
Yes, it's the 6th today, and he seems to be more in sort of a holding pattern, like a waiting mode, waiting for the peak to hit. And he seems fairly reassuring, but he also, said that Tri-City, like all the other hospitals, really cannot know if they're going to be prepared enough, especially when it comes to all the PPE and the equipment that they need. They've got enough right now, but will they be able to order more when that runs out? That still seems to be a question.
And from the county's numbers, for both, say, Oceanside, Carlsbad, or the county as a whole, the total number of cases are still doubling about every 6 or 7 days here in the county. So that doesn't appear, at least with the latest data, to have slowed down at all.
Well, yes, I don't think they're going to slow down for a while, are they? That's true.
Yeah, probably not.
But it does seem as though North County, for some strange reason, is not a hotspot, which surprises me, because they do say that a lot of people who have the resources to travel are some of the first to get it. And, you would have thought a lot of people in North County, especially coastal North County, might have been traveling and might have it, but it doesn't appear to be manifesting that way.
Although it's interesting that you bring that up because Carlsbad is the
true.
North County cities is the leader in the number of cases, and I
Tested cases.
why I have not a clue.
Is it because they have more testing, one wonders, or is it really
I
more
don't know.
cases? Yeah, that is a
That
good.
I don't know.
And then, of course, we have the question of the homeless. I mean, I see homeless down by the pier in Oceanside still who are not in any kind of a shelter. We don't have a shelter like the convention center does down in San Diego. So I think a lot of homeless are deciding to just ride this out on their own. And it remains to be seen whether they can avoid it, whether it will hit them particularly hard.
Right. It sounds like most of us are not going to be able to avoid it ultimately. Not with
That's
the
true.
vaccine being at least a year out, according to various doctors.
Right.
We've got a clip here from Sean Evans, who is an emergency medical specialist with Scripps Hospital in La Jolla. If we can listen to that.
We are seeing critical illness. We're seeing critical COVID illness, and it seems to be growing. Our ICUs are going to be impacted. Many of these patients require advanced life support and ventilation. These are challenging. We've now mastered our choreography in that regard, with regard to protecting staff and protecting the patient and making sure they get what they need. Ultimately, as time goes on, we'll see more of those patients. We have the resources at the moment, and we have the ability to structure our planning within the hospital to accommodate them. But this is a process that's won based on the community's efforts to stay at home, social distance, and isolate when necessary or when someone has a suspected illness. On a daily basis, we're intubating patients and we're taking care of heavily viral patients. What this means is we're busy and we're taking care of patients in the best manner we can at this time. San Diego's history as it pertains to this COVID outbreak is going to be written in the next 2 to 3 weeks. And this next 2 to 3 weeks, with the public's cooperation, we can do fantastic things. Without the public's cooperation, or with people becoming impatient or beginning to loosen their social distancing, we can be in a catastrophe, as some of these other cities have experienced. We're very fortunate in San Diego because some of the density metrics for our lifestyle aren't appreciated here. We don't ride mass transit. We don't all share the same elevator button or the same hand railings or the same guardrails in a subway. But San Diego has the capacity to explode if we're not all careful and looking out for one another. For the community, think of areas as COVID hotspots, and certainly the hospital would qualify as one. As such, we'd ask that visitors not enter the hospital. We have a no visitation policy for their protection. We'll always work with families to keep them visually engaged through their phones and speaking to their patients in a time of crisis, and we'll absolutely give updates as necessary. What's so important is the understanding that we're doing this for the protection of everyone in an area like a hospital that's a COVID hotspot. And we hope that everybody understands that with part of the distancing and not allowing visitors, that doesn't mean that they can't FaceTime or Skype or chat with them. It just simply means that we've got to protect the community as well and not have people free-floating in and out of this hospital. Please understand that we'll do everything for your family members in your absence. In effect, we'll become part of your family. As an emergency physician here at Scripps Memorial La Jolla, I'm proud to say we're prepared, more so than we've ever been. We've taken fundamentals in our physical plant, we've built out spaces for COVID and viral patients at this time, and we've done everything to keep staff safety. At this point, we're on the front lines. We're the COVID hotspot. We arrive here every day. We're proud to take care of the community, and what I would say is we're here for you. We're here for you, but we need your help. Ultimately, this disease outbreak is going to be proven in its history by the cooperation of you in the public, patients staying at home, social distancing, staying off work, and not bringing that virus to one another is the absolute key. We're very proud here. We're very proud to have learned from the experiences of all of those people in different cities where the outbreaks have become catastrophic. We don't want that, but we're here and we'll be here for the community. A great deal of work has been done to protect both the public as well as patients here at the hospital. What's so important is to understand that when patients arrive, we're going to ask families for their phone number and to wait in the parking lot until we've determined whether someone will go home or not. As soon as a patient arrives, they're greeted by a team of nurses who will do an initial screening. If somebody has minimal symptoms or concern for a viral illness, they will be sent to the tents behind us. They'll undertake screening, basic laboratory testing, as well as chest x-ray and EKG in some cases. From there, our hope is to return them home. For patients who are more ill, arrive by ambulance, it's critical that we have phone numbers for family contacts so that we can reach out. Those patients are also greeted, each of them individually, by a team of nurses to identify if they have any viral syndrome. If they have a viral syndrome in this environment, we take them to an overflow area called the COVID-19 Emergency Department. It's a separate care pathway for viral patients that we've built. Through putting up walls, advanced signage, and precautions that are designed to benefit both the patient as well as the treatment staff, these isolated units exist within the hospital to protect the patients, the staff, and anyone entering our healthcare community.
Allison, what did you take from Dr. Evans' presentation?
Well, one of the things that struck me, Kent, was the reality of the fact that people are sometimes bringing a loved one to the hospital and dropping them off, and then they don't get to go visit. So that might be something for everyone to be aware of, is that, if you're going to take someone to the hospital, be aware that you need to be ready to provide your phone number, because they'll give you calls as to how it's going, but you might not be able to go visit them. So there may be things you can do to prepare when you are taking a loved one to the hospital, making sure they have the things you want them to have, and mentally preparing yourself for that separation, which must be a bit of a shock for people when they drive up.
I can speak from personal experience. It's a little bit of a shock. My father went to had some surgery today. My sister took him and she had to drop him off. And I got a text from her saying, I'm going to go wait at home until they call me so I can go get him again. And he's fine. It was a successful surgery. But it was a shock to her.
Yes, right. So that is something that, I think we all have to be aware of, is that things can evolve very fast. And that if we take that step to going to the hospital, which probably we don't take unless it's gotten pretty bad, to be prepared for, a bit of a separation, and make sure that the hospital knows our phone number, and that the patient, has a cell phone that they can use to communicate with you, because that might be the only way that you can communicate with them. Yeah.
Thank you very much for joining us on KOCT's North County Roundtable with my co-host, Allison St. John. I'm Kent Davey. It has been a pleasure to talk to you tonight.
Thank you for staying with us. And remember that you can always catch a lot of other programming that KOCT is doing about the COVID-19 pandemic by going to koct.org. At 2:30 every afternoon, KOCT covers the San Diego County media briefing with all the latest news about what's happening around San Diego County, and you can see that on Cox Cable Channel 19. Also, KOCT's Facebook page is a great place to check in for more information. So until we see you again, stay safe.
And wash your hands.
And wash your hands.